Well, I have the pleasure to introduce my friend from Egypt. We're both from Egypt. So Dr. فريدي البياضي, he is not new to GILP. He is one of the founders, actually. He came so many years. He is a very, very good speaker. And he already, I mean, there's so many things to say about Freddie. But he has already founded the Peace Center, Medical Center in Egypt, and it is keeping running and growing and helping so many poor in his town and his area. So he's very well known for that. He's a founder and CEO of the Peace Medical Center. And also he is a member of the Egyptian parliament for his district since 3 years now. 3 years, and we are hoping that he will be continuing for the coming period of the parliament as well. Dr. Freddie, we have the pleasure to have you. We're so looking forward to hear from you. Thank you.
Dr. Freddie, Laura will keep you posted on the time. She'll give you a 5-minute notice and a 1 minute and a 0.
Okay, and I keep ignoring that. Well, thank you so much. It's always a pleasure to be back again to GILP after 3 years, almost the last time. It's good to see people again, and we have been in Zoom meetings, but face-to-face is a different thing. It's my pleasure to speak about this topic, peacemaking in a troubled world. This is my family. Marianne is my beautiful wife, and my 2 sons, Nair and Rani, and Toby is our dog. So just a quick presentation about my family and background. Are we in a troubled world? Do you think we're in a troubled world? Yeah, it is. It is getting more troubled every day, probably. And the statistics, the pandemics, the wars, the conflicts going around is really getting people worried and scary about what's going to be tomorrow, what's going to be in the future of this world. There are global conflicts, armed conflicts, as I said, pandemics and wars all over. There are some numbers I want to share with you. Do you know how many wars are going on in the world today? The definition of war is variable, but some people are putting definitions according to the number of deaths, according to the internal wars or international wars from countries to countries. But one of the research academies, which is called the Geneva Academy for International Humanitarian Law and Human Rights, they said there's 110 armed conflicts going around the world today. 110. And they defined it as armed conflicts with 100 deaths or more. That can be internal, over land, over drugs, over religion, over whatever. But there are 110 armed conflicts. This is a scary number. The pandemic, which all the world suffered, till last week, the WHO announced that the number of deaths is 6.9 million deaths from COVID-19 only, all over the world. It's another scary number. People are displaced from their homes, refugees. Also, the definition of refugees is different than the number of displacements. But according to the UN High Commission for Refugees, they say there is 108.4 million displaced out of their homes today. So the people might be displaced internally or in other areas. So there are global conflicts, social injustice, humanitarian crisis. There are 2 vital elements in peacemaking that I'm going to share about today, which is actually my personal experience over the 25 years. But peacemaking is can be a 1-day seminar, can be a 1-week seminar, can be a 1-year study, can be a lifetime process. But I'm going to share about my personal experience in 2 fields over the past 25 years, which is building peace through fulfillment and harmony through correct political leadership. It's greatly needed now, more than ever. Peacemaking is greatly needed. Peacemaking, as I said, is a lifetime process. I'll share with you the role of healthcare in peacemaking. And some people can maybe ask what has healthcare has to do in peacemaking. But this is my personal experience 25 years ago in a suburb of Cairo, where we have sometimes in Egypt, there is some religious conflict, some fundamental ideas from time to time according to faith. And there's a great need for healthcare. I'm a medical doctor. This is my medical study. So I decided 25 years ago with a group of friends to start a small clinic to serve the community, serve the poor people who cannot access quality health care. In our area, actually, there's a big problem. I know health care is a problem everywhere in the world, but in our area, it's a great problem. Many people cannot access quality health care. So we decided to offer quality health care to the people who cannot access it. But there was a great vision behind this, not only serving quality health care, but we try to get Christians and Muslims who sometimes get in conflicts, who sometimes get in misunderstandings, and sometimes in violence. So we got them to work together as volunteers to serve the community. And by working together, they get to know each other. By working together, they get to understand each other. They don't have to convert each one to the other's religion, but they have to respect each other's religion. They build bridges. They build peace. They do reconciliation. And Christians in Egypt are minority. They're like 10% of the population. So it happens that most Christians understand about Islam faith, but many Muslims don't know enough about Christianity because they don't get exposed to many Christians. So when they get to meet each other and they understand, they correct a lot of stereotypes, they correct a lot of misunderstandings about each other. And I always say to our staff, we don't need to change each one to be in your own religion, but make him respect your faith, make him love you as a human being and respect you as a human being. And this is what's done at Salam Medical Center. These are real photos from Salam Medical Center. You can see me doing ultrasound. This is my specialty as a radiologist. So at Salam Medical Center, we do, thank you, medical aid. We offer essential medical services, including primary health care, emergency care, and specialized treatments to vulnerable populations affected by conflicts or poverty. We do trauma rehabilitation in conflict-ridden areas. The center focuses on trauma rehabilitation, helping individuals recover physically and mentally from family violence or psychological insults. We do also cross-border collaboration. Salam Medical Center collaborates with international organizations, sharing resources and expertise to address global health challenges and promote peace-building initiatives. This is a 2-minute video from Salam Medical Center. I want to share it with you.
القناطر الخيرية town is located in Qalyubia Governorate, north of Cairo City. It's populated by about 400,000 persons. As a result of ignorance and the lack of hygiene, some diseases prevail in القناطر الخيرية, such as bilharzia and hepatitis. Mortality rates are also high among women and newborn babies. In the midst of all ignorance and illness, there had to exist peace. That's why Salam Medical Center, whose name means peace, came to existence.
الاطباء والطاقم الفني اللي موجود في المكان على مستوى عالي جدا. لو مش كفء ما كنتش شفت النتيجه اللي انا شفتها في بنتي بصراحه يعني. انا قعدت كام سنه وانا بعمل ما شفتش اي تحسن في المكان اللي انا كنت فيه بره. ساعه ما جيت هنا فتره قصيره قوي وشفت تحسن ما كنتش متوقعه بصراحه. بتخدم مسلمين وبتخدم مسيحيين. المبدا اللي اتعلمناه من السيد المسيح انه كان يقول يصنع خيرا. المسيح عمره ما سال الانسان اللي بيشفيه انت دينك ايه أو جنسك إيه؟
بعض الناس فعلا وجهت لي سؤال زي إن ليه بتشتغلي في مكان ينتمي للكنيسة في حين ممكن تأدي نفس الخدمة لمكان يحتاج أكتر ينتمي للجامع. فبصراحة أنا لحب المكان وإني ما لقيتش فيه فرق ده بالعكس شجعت بعض الناس او الدكاتره التانيين زميلاتي ان هم يشتغلوا في المكان ده، لان زي ما قلت لحضرتك ما لقيتش فيه فرق.
هو اجر رمزي شويه، بس احنا يعني عاملينه اللي هو تطوع للمركز وللناس وخدمه وكده.
اي تبرع انا بديه للمستشفى هيعود عليا في الاخر وهيعود على الناس كلها.
مستوصف السلام بيتميز بحاجه مهمه جدا، ان هو في تطوير مستمر، يعني شباب دائم.
This photo is very illustrative of the message of Salam Medical Center. In 2013, after the Muslim Brotherhood regime was removed from power, there was a fearful attack against Christians and Christian properties all over the country, because they believed that Christians were part of the demonstrations and revolution against the Muslim Brotherhood regime. And in these days, there was fearful attacks. 79 churches and Christian properties were burned in one day. And one of these days, we heard about the demonstration coming from villages around us, from Muslim Brotherhood supporters marching into our town. And the hospital, as you see it clearly, is a Christian place. It's owned by the church in a church compound. And me personally was one of the, or still on their wanted list for the Muslim Brotherhood, because I was one of the leaders of the revolution, the peaceful revolution against Muslim Brotherhood. I was at the Senate House at this time, and I resigned to be in the street calling for peaceful revolution to change the regime. So we were actually worried about what will happen to the hospital. Will it be attacked by the people in the demonstrations? But to my surprise, I saw the young Muslim men lining up in front of the hospital and the church to protect it as human shields in case anyone might attack the hospital. And this day, actually, I cried in tears and said, we didn't waste our time in the past years. We saw the fruits of the work, the peacemaking and reconciliation, and the people and the community people who were willing to defend the hospital and the church by their lives. Well, political leadership. You might ask yourself, what's the connection between healthcare and political leadership? There might be not many connections, but with my personal experience, it was a connection. This is how I got into politics. Back in 2000, I had nothing to do with politics. I was a CEO of the small clinic which we started, focusing my work on starting this project, how to keep it up, how to do fundraising to keep it operationally sustainable. And this day I got an invitation to meet with the General Secretary of the National Democratic Party. And at this day, there was only one functioning party. It was the President's Party, President Mubarak at that time. And there was no other active parties. And it was also a great privilege for anyone just to be connected or affiliated or a member of this party. You will get a lot of privileges from the government. So I got an invitation to meet with the General Secretary of the party in our state. I went to meet him. He said to me, we are following very well what you are doing in the hospital and how much impact and appreciation it has received in the community. And we are looking for young people to be part of our central committee in the state. I was young at that time, of course. It was back in 2000. And the guys, I was actually hesitating to accept this because I was already committed to other things. But he said to me, I know that whoever joins politics in our country is usually looking for one of two things, either for popularity or for money. And I'm sure you don't need any of them. And he was wrong. At least I needed money at that time. So he said, we want you to be part of our central committee of the party. After some thinking, I accepted. It was a good way to help people to get their rights from the government. So this is how I started my relation with politics. In 2013, after the Muslim Brotherhood regime came in, the Muslim Brotherhood president at that time wanted to show that they have tolerance and diversity to other religions and other groups. So he asked the church to nominate a number of names to be appointed at the Senate House. Because according to the Constitution, the President can appoint a number of senators at the Senate House. So my name was nominated from the church and was appointed by the Muslim Brotherhood President at that time in the Senate House as a senator. And from day one, I was opposing the President who appointed me, and it was strange. So, and I resigned in less than 1 year, asking for the peaceful change of the regime, and it happened. In 2020, I was asked by my party, which is the Egyptian Social Democratic Party. And again, our Democratic Party is different than the American Democratic Party. It's mainly focusing on democracy and freedom and minority rights. We focus on women empowerment, youth empowerment. So I was asked to run for elections, and I was voted in to be a member of the Congress, the House of Representatives, from 2021. So we focus, I experienced focusing on legislative advocacy and community engagement and international cooperation. I'll try to be fast for the time. The power of collaboration between healthcare institutions, political leaders, and international organizations is really essential. We can address the root causes of conflicts, promote equality and justice, and build a sustainable future for all. The vision for peacemaking, which started with me as a local vision in a small town, it became a national level. Many times I'm speaking in the parliament, in the national TV in Egypt about peacemaking and reconciliation. It even had some international platforms. Here I'm speaking at this conference with the many distinguished and honorable people from all over the world. So the vision actually expanded in a great way. We can provide vital services, advocate for peace, justice, and equality. Thank you so much, and I'm really looking forward to, if you are still awake, looking forward to have more discussions at the rest of the conference. Thank you.
Thank you, my friend. That was an unexpected slide there at the end. Thank you. Oh, to have a leader like Dr. El-Biadi here speaking, a medical doctor, member of parliament, is an honor. So thank you, sir. And been a long-time friend of ours from Cairo. So Medhat, thank you for introducing Dr. El-Biadi.